That's one heck of an intro. Thank you, Rachel. So we all know the side effects of birth control, the pills. You know, it's usually weight gain and moodiness. Every woman knows this who's ever taken it. But sometimes there are severe side effects to the birth control, and effects can lead to migraines, even depression. So how do you know if it's the pill that's causing your pain, and what can you do before things get worse? Here with more is Dr. Paul Wilkes. You've seen him on the show before. Doctor, thank you so much for being here. Yeah, I guess moodiness and migraines, those are things that we hear about all the time. The weight gain, that sort of thing.
Yes.
But the depression, that's a little scary. Let's talk about birth control.
Yes, so the important thing to understand is there are different, we think of this as the birth control pill.
Right.
Most birth control pills, the combination pill that has both estrogen and progesterone, has the exact same kind of estrogen.
Okay.
The different progestins or progesterones in the pill are the ones that may affect women differently.
Okay.
So the progesterone-only pill is usually only used in breastfeeding women after they've given birth. But the combination pill is by far the most commonly prescribed.
Okay, let's talk about what you have here.
Okay, so when you talk about the combination birth control pill and which of my symptoms are related to the pill and which of my symptoms may be something else, really the most important thing to understand is, did you have any of these symptoms prior to starting the pill?
Okay.
If the answer is yes, then it's probably not caused by the pill, although it could be exacerbated. For instance, headaches. If a woman is predisposed to headaches or migraine headaches, yes, a combination birth control pill can make that worse.
Make it even worse.
The good news is, though, if you stick with it, generally most of the side effects of the birth control pill will go away or lessen with time, and usually by 3 months.
All right, let's move on to our next contraception here.
Okay, so if you find you've tried all the tricks to make a birth control pill work and it doesn't, then another alternative would be, for instance, an IUD or an intrauterine device.
Okay.
There are IUDs that are good for 3 years, 5 years, and 10 years, and they can be placed in a relatively simple and painless office procedure.
Let me ask you this, Doc. Now, I've heard that a woman, if you're taking birth control, you should not take it more than 10 years. Is that still true?
No.
It is not true?
No.
Okay.
That comes from studies with older pills, higher dosage estrogens, and less sophisticated progestins.
I see. Okay.
So yes, over time, staying on the birth control pill used to be dangerous for certain kinds of side effects and cancers, but that's really no longer the case.
Advanced technology.
Yes.
All right. So right now we see all the commercials when we hear all of the side effects, and some of them it's like, you know what? Why even take a chance? This is crazy. Your head can fall off. One arm can twist backwards. Your head will spin around. You know, so it's like, is there a safe alternative? Is there one that you recommend to your patients on a regular basis?
Do you know, it's really trial and error, and I think all of us have our own favorites. And I know that my partners over at Desert Perinatal Associates, if you asked all 8 of us, what is your first line birth control pill, you might get 8 different answers. And that really comes from experience and comfort. They're all mostly the same. So it's a lot of trial and error. If I give you a birth control pill and I say, listen, give me 3 months, stick with it for 3 months, and at the end of 3 months you say, listen, I'm miserable, you know, we need to make some changes. The other thing is, specifically with depression, you can add an antidepressant, or you can change up the birth control pill and see if those symptoms go away.
Dr. Paul Wilkes, we could talk about this all day long. I love all of your topics. So the best line of defense is talk to your doctor before doing anything.
Absolutely. Full physical exam and see your doctor.
All right, we appreciate it, Dr. Wilkes.
Thank you.
All right, there's the info, Rachel. Things have changed.
And that's not a toy, that is a prop uterus, kids, okay?